Okay, this video is going to go over the meninges. So we're going to be talking about the layers that surround the brain and spinal cord. We're going to take a look at the meninges and their spaces as well. So again, you're going to need to know this for both lecture and lab. This is just a video. This is actually a human brain that's on the tray here. And I don't know who the person is that's giving the presentation. But anyway, it's a really good video explaining she's doing a brain dissection and discussing the structures in the meninges. So pretty good video in case you're interested in something like that. This right here is probably, you've got a handout in your packet for this. This is probably the best one that to just explain where everything is. Again, you need to know these as well. So you've got your brain right here. You've got your gray matter right there, and you've got your white matter right there. And this is the cerebrum, right? You've got your cerebral cortex, which is your gray matter, and your cerebral medulla, which is your white matter. Now, surrounding the brain, you have got three layers. The layer that is touching the surface of the brain is the pia mater. That's delicate is what that stands for. So it literally is this white line right here. It's going to follow all the grooves and all the crevices, the sulci and the gyri. It's going to surround all of that. It's going to cover all of that. You're not really going to be able to pull the pia mater off of the surface of the brain. It's attached, and it kind of has a shiny appearance. If you look real close at some of the dissections that we've done, you can kind of see, you can maybe get that probe up underneath of that just a little bit. It's not like you can really peel it off like an onion or anything like that. Now, just above the pia mater, you have what's known as the arachnoid mater. So this area right here, which is this represented by this white line right here, notice there's some space between the pia mater and the arachnoid mater. So there's some space there, but the arachnoid mater is a layer. It's actually the center layer of the brain, of the meninges. Again, there's three meningeal layers. The arachnoid is the one in the middle, and it's called that because it kind of looks like a spider web. Okay, and you can kind of see in there that space underneath kind of looks like a spider's web. Now, the meningeal layer that is the most superficial, that sits on top, is the dura mater, and this is represented by this thicker blue line right here. And the dura mater is very thick. It's you can't really pull it apart or tear it. I mean, we're talking it is thick. Definitely going to need a scalpel or some scissors when you get in there. It looks like a swimming cap that sits on top of the brain. And you can see in relation to the skull bone, to the cranial bones, where that dura mater is. And you can see there's a space between the dura mater and the skull, and there is a space between the dura mater and the arachnoid mater. So now let's take a look at the spaces. So looking at the dura mater, which is this lighter blue line right here, the space between the skull and the dura mater is the epidural space, which is this area right in through here. That's that epidural space. If you think about the word epi, it means on top of, so this is the space above the dura, right? And you're going to have a lot of fat, blood vessels, lymphatics there. Now, below the dura is the subdural space, so it's going to be this area right in here. The subdural space is going to be filled with serous fluid. Below the arachnoid mater is going to be the subarachnoid space. So look at these prefixes here, and that kind of tells you where they're going to be located. The subarachnoid space is a pretty large space in comparison to the other spaces, and this is going to contain cerebral spinal fluid, so it's a pretty large space. Not so much the subdural space and the epidural space, they're not very large, but that subarachnoid space is pretty big. Again, just what we've already said, you've got your three meningeal layers that surround the brain and spinal cord. So remember, we're talking about the central nervous system, which contains both. And while we just mentioned the brain there, keep in mind these do surround the spinal cord as well. And what is the function of the meninges? To protect and support the cerebral spinal fluid, the central nervous system. And it does contain cerebral spinal fluid within these meningeal layers in that subarachnoid space. Again, the dura mater, it's very dense in comparison to the other two. You can see right here the dura mater and the skull, and you can see that not really a true space there, right? The epidural space, that's really not a true space there. You can see the arachnoid mater and the dura mater, and you can see not really a true space there either. That subdural space, not really a true space. Where the subarachnoid space, that's a pretty true space. And look, you've got blood vessels and all kinds of stuff in there. Okay. The arachnoid mater, again, kind of looks like a cobweb, spider web. It cushions the central nervous system. So this is really more for protection, right? Got a lot of cerebral spinal fluid in there for protection. The pia mater, innermost layer, follows all the contours of the gyri and the sulci, adheres to the surface of the brain. So like I said, it's represented in green up here. You cannot really pull it apart from the brain. It's part of it. It aids in the secretion of cerebral spinal fluid, very delicate. I'm not going to worry about the leptomeninges, okay? Now, meningitis, itis means inflammation, so this disease is inflammation of the meninges. So if you've ever heard of meningitis, that's where that name comes from. It's inflammation of the meningeal layers. There's a 2-minute neuroscience video on the meninges if you want to take a look at that. Now, here are your spaces. Now, as far as the cranial and epidural, cranial and spinal epidural space, I'm not going to differentiate those on the test. I'm just going to call it the epidural space, subdural space, and subarachnoid space. The epidural space, this is what's called a potential space. So it doesn't exist until, honestly, there's kind of been some injury. So it does have arteries and blood vessels, but it's not a true space. It's a potential space. So, for example, if we're looking at the epidural space and blood pools in that space, that is called an epidural hematoma. And you can see that that blood is causing the dura to separate from the actual bone, okay? So that's due to that injury. Where opposed to a subdural hematoma, this is going to be below, this is in that subdural space. Again, not a true space. So you can see right here, there's not much space right there in that subdural space. So again, it's more of a potential space, and that will occur. You're going to see it more when there's injury or trauma. In the epidural hematoma, that's mainly going to be arterial blood, so it's going to be pretty dangerous because arteries tend to bleed out. You tend to lose a lot of blood with arterial breaks. Venous blood, again, still dangerous because you can look at the pressure on the brain and see that, you know, that brain has nowhere to go. So it's definitely putting pressure on the brain in both situations. The epidural space, I'm not going to get into the difference between the spinal and the cranial epidural space. Just kind of because people ask the question here. If somebody is given an epidural, for instance, when they're having a baby or something like that, if you take a look at where that needle is going to go, it is actually not going to penetrate the meninges. It's going to stay above the dura. It is not going to penetrate the meningeal layers, and that spinal cord is you know, hopefully pretty safe. However, if somebody gets a spinal, that is actually going to go past the meningeal layers and get that medication right there at that spinal cord. That's obviously a lot more dangerous. Subdural space, it's a potential space again between the dura mater and the arachnoid mater. It contains veins. Okay, so that's why if there's a bleed, it's going to be venous blood that's going to pool in that area there. Both are dangerous in the sense that they're putting pressure on the brain, but a venous bleed is going to bleed slower and than an arterial bleed for sure. Subarachnoid space, this is a true space. Okay, actual true space that exists at all times, and it's going to be filled with cerebral spinal fluid. It also has blood vessels there. We're going to talk about those blood vessels here in just a little bit, but it does contain blood vessels. A hematoma. A hematoma is a pool of mostly clotted blood that forms in an organ, tissue, or body space. A hematoma is caused by broken blood vessels that was damaged for whatever reason, some kind of trauma, and can occur anywhere in the body, including the brain. So this right here is a cross-section of a brain, actually a frontal cut. You can see your corpus callosum right here. So we're looking at the back part of that. This right here is the subdural hematoma. So this right here is that dura, and you can see, I don't know why those stray marks happen. It absolutely drives me insane. But anyway, you can see the dura there, and you can see that clot that has formed below that, and you can see the shape of the brain and how it's changed. Obviously, this is probably what killed this person. So these are just different types of brain hemorrhages. Just thought I'd throw that out there because it's interesting. I'll let you look at that on your own. If anybody's ever heard of shaken baby syndrome, this is what happens in shaken baby syndrome. You have got hematomas that form because the brain is literally, when a baby is shaken, yes, that in that subarachnoid space, that cerebral spinal fluid acts as a cushion to protect the brain from bumping up against the skull bone. However, in shaken baby syndrome, they're shaken so hard that that no longer is really able to protect. So that causes bleeds and stuff when that brain bumps up against that those cranial bones, and causes brain bleeds. And you can see the difference in the shape of the brain and the how that works. So shaken baby syndrome is a type of brain injury that happens when a baby or young child is shaken violently. So this is not an accident, okay? This is not some kind of injury that was accidental. When this happens, the brain bounces back and forth against the inside of the skull, which can cause bleeding, bruising, and swelling. Now, with those cranial bones, you know, there's not a lot of room for swelling of that brain to occur, right? Shaken baby syndrome is known to cause long-term brain damage and even death. So it is very severe. This is just showing you an x-ray of a 6-month-old infant who the parents had said fell off of kind of like a baby changing table is what that is. You can see the subdural hemorrhage on the right. So all of this right here, that's all subdural hemorrhage going on, subdural hemorrhage. So really bad. And you can see the difference. I put the normal brain up here so you can kind of see what that brain is supposed to look like, but definitely damage is done. If anybody has seen the movie Concussion, again, based on a true story from 2016, this has to do with football injuries related to, this is why football players can't lead with their head anymore. They were having micro hemorrhages within the brain, which was causing the football players, professional football players, I want to say this was Philadelphia if I'm not mistaken, long-term side effects, like they were having dementia and things like this at 40 and 50, things that they shouldn't be having at the ages they were having them after they'd already retired from football. So this doctor came about and discovered from cadaver brains of these football players, that was after they'd already died, he found these micro contusions, these micro hemorrhages, which were not visible on CT scans and MRIs while they were alive, which actually led to their death. So pretty amazing little story there. Good, based on a true story, pretty good movie if you get a chance to watch it. Okay, and that concludes Objective 6.